Welcome back to part 2 of this series where I talk about atrial fibrillation, and today I'll be telling you how doctors treat atrial fibrillation. If you missed the previous video where I talk about the causes and diagnosis of atrial fibrillation, feel free to check it out, the link will be in the top right corner. Welcome to another episode of Doctor Says. There are 3 main goals for the treatment of atrial fibrillation. The first is symptoms control, or known as rate control. The second is rhythm control, which means attempting to restore the heart to a normal heart rhythm. And lastly, to prevent the number 1 complication of atrial fibrillation, which is stroke. In the first strategy of rate control, it involves trying to bring the heart rate down to a near normal level. If you are treated with rate control, you will continue to have atrial fibrillation. However, you will take a medication, commonly a beta blocker, calcium channel blocker, or less commonly, digoxin, to slow the electrical conduction from the atrium to the ventricles. This aims to eliminate the most common symptoms of atrial fibrillation, which is palpitation. But because this does not eliminate the fact that the atrium is still fibrillating, there is always a risk of stroke due to blood clot in the heart. Hence, blood thinners or anticoagulant is usually required along with this treatment. The second strategy is rhythm control. In atrial fibrillation, there are hundreds of random electrical signals generated by the atrium instead of a consistent single signal generated from the sinus node. Therefore, this approach aims to restore and maintain a normal heart electrical signal generated from the sinus node. There are 2 ways of doing it. The first is by using medication, also known as antiarrhythmic drug, and the second is by using electric cardioversion. In case you are wondering, yes, this is exactly the same type of electric shock you guys watch on the television, whereby doctors use to restart the heart of a dying patient. Except in this case, the person is not dying. Of course, electric cardioversion can be quite traumatizing and there's no guaranteed success. Oh no! Another more modern approach is catheter ablation. In this procedure, a catheter is placed into your heart and either heat, radiofrequency ablation, or cold, cryoablation is used to destroy the heart tissue that is sending abnormal electrical signals. Depending on patient factors and how long one has been diagnosed with atrial fibrillation, your doctor may prefer either rate control or rhythm control. The advantage of rhythm control and catheter ablation is, if one can maintain a normal sinus rhythm thereafter, they may be able to stop taking anticoagulant or other antiarrhythmic drugs. And lastly, the goal for any treatment for atrial fibrillation is to prevent blood clot from forming in the heart and travels to the brain to cause a stroke. Hence, blood thinners, or also known as anticoagulant, is used to prevent this blood clot from forming. Doctors use a scoring system known as the Chadva score to determine if our patients need to be anticoagulated. For men, a score of 1 is enough to warrant the initiation of anticoagulant, while for women, a score of 2 or more is needed. There are many options available. The commonest will be dabigatran, rivaroxaban, and apixaban. Do note, however, every patient who is on an anticoagulant will need to be informed regarding the risk of bleeding while they are on it. And all of them will need to be assessed by a physician for any bleeding risk before starting on this medication. So there you have it, guys. This is how doctors treat atrial fibrillation. Do you know that 15% of patients with hyperthyroidism have atrial fibrillation? And the treatment is different. Want to know more about the treatment of hyperthyroidism? Click on the link to find out more.